everybody. Sorry we are so late with the live. We have had a couple of struggles. Just hang in there with us. We're trying again. We're going to try until we get this to work. We're going to try to get Irma online again. Let's thumbs up. It's going to work. Please stay on and watch. I'm just needing to get Irma online. And let's hope it's working this time. Okay. I've got big hopes for tonight's discussion, so I really hope that Irma can connect. We have now tried like maybe 5 to 6 times, so let's hope that Irma can connect. So in the meantime, leave a comment below. Let us know where you are watching from. I am live from Germany. Let us know where you are watching from. So while we wait to see if Irma can join us, let's keep the conversation going. If you have any questions about herbs, maybe you can leave them in the comment box below so long, and then once Irma joins, we can get to it then. Let's see. Oh, my dear Irma, I hope you can join. Irma isn't able to join. Oh, let's try again. Okay. Okay. Yes! Hallelujah!
Hallelujah.
Okay, there's hope. There's hope. I just can't see you. Where are you?
Let's see.
Your voice. Oh my gosh.
Oh my goodness. I am so absolutely sorry about this. I don't know what is going on.
No worries. We would love to see your face at one point.
So yes, that seems to be the next obstacle. No. Where is it?
There's something's happening. It's your front camera, right?
Wait, yes, let's see.
There we go. Okay, I'm looking at the laptop.
Okay, right. So can you see me?
Yeah, I can. Yay!
Yeah, I am so absolutely sorry about this now. You know exactly how advanced I am.
You had me nerve-wracked.
Oh, my nerves. But anyway, here we are, half an hour late. I am, please accept my apologies.
It's okay. You know, it's your first time and we struggle and we make it happen. That's it. Honor then. Sorry for those who don't understand that. Okay. Ladies and gentlemen, I can now introduce you to Irma de Pre. She's a medical herbalist. She is living in Belgium, but she is proudly South African, like me. And we actually grew up in a similar area. She's like 1.5 hours drive away from me. She's from Pretoria, and originally. But I think you said you're like over 20 years already in Belgium?
Yeah, I'm in Belgium. I've been in Belgium for 14 years now, so I'm pretty here now. So
yeah. Okay, yeah. Okay, no, I don't know why I thought it was over 20 years. Okay, so Irma, tell us about yourself. Thank you for joining, and tell us about yourself, about your studies, and how did you get into medical herbalism? And yeah, would love to hear.
I'm going to try and keep it short because I can write a book on that one. So thank you for inviting me. It's nice being here to start off with. So as a medical herbalist, what are we actually? You know, we've got a 4-year sort of bachelor degree level training in herbs, but with a medical background, which means we can of course, do things like interpret blood tests. We can do physical exams. We can diagnose. I'm not allowed to say that out loud because in Belgium that is not allowed.
Yeah.
But anyway, that's the basic training. But getting back to how I got into herbs, it actually, yeah, it happened rather suddenly. I think growing up in South Africa, you grow up as a barefoot kid.
Yeah.
So you sort of have it, but you don't know that you've got it until you haven't got it. So, yeah, I was actually working in the line of interior decorating at one stage, and I was very proud of my job. I mean, we worked on these large golf estates. They jumped up like mushrooms in the garden route area where I was living at that stage, and I was very involved in these golfing estates. And then one day I flew back to George, and in the aeroplane I was looking down as we were about to land, and I saw these really ugly patches of green manicured golfing estates, and I thought to myself, you know what, the garden route is well known for being the garden route, and they are just absolutely messing up a pristine nature. So that was sort of the first time that I realized, what if you haven't got nature anymore? So I started getting involved in all sorts of nature-based activities, etc. And I actually went on to become a naturopath, but it wasn't quite my thing. All the massage, this, that, and the other, that didn't intrigue me, but I liked the herbs so much. And we looked at Ayurveda, and we looked at traditional Chinese medicine and so on. But it was actually the Western herbal medicine that fascinated me, you know, because after all, Ayurveda, I'm not from India.
Yeah.
I'm not Chinese. And I was really excited to realize that there's actually something like Western herbal medicine. I mean, meant for us Westerners, you know. So then I moved to Belgium, and I wanted to learn the language, but I thought, oh, boring language course, I don't want to do that. I'm going to just enroll myself in some other course, and it happened to be herbalism. Oh, and actually, from then on, yes, the one course after the other, until I decided I am going to really get into this, and then I did this Bachelor of Science. So that's a bit about me. I'm a bit of a nature freak. I love being outside. My job doesn't always allow me being outside. I sit behind my computer a lot. I see patients in my practice. So yes,
Well, that is really exciting. Thank you so much for sharing. Now, we would love to discuss the benefits of herbs and spices tonight and how it is affecting all the different body systems. So I have a set of questions that I would like to ask you, and just feel free to, give your insights and share with us what you feel in your heart to share. And because I know there is so many different herbs and spices, and we won't be able to cover all of them. So let's see which ones we can cover and which ones we can use specifically for this winter to carry us through. So let's start off with the basics. Let's lay a foundation. What is the difference between a herb and a spice?
Okay, that's a really good question. So I think in my practice, I talk about herbs, and that includes all plants, but that is just general way of speaking. So when I talk to patients, I'm going to say, I'm going to put this herbs into your mix, but it might be that it's from a tree, or it might be that it is algae or mushrooms. We just talk about all of it as herbs. But in technical terms, there's a bit of a difference. And I think it's best described as a herb is something that is your above ground part of your plant. And then spices is normally, so a herb is like, what have we got? We've got basil, we've got coriander, we've got thyme, lavender, all of those. The more soft things that grow above ground, the leaves, the leafy parts, stems. Okay, so then spices, that is the the harder stuff. It's your tree bark, it's roots, it's things like cloves, which comes from a flower. It's all those harder stuff, and very aromatic as a general rule. So that is why we use them. I mean, think of cinnamon bark. Yeah. So yes, that's more or less the difference, I would say.
So, okay, so basically herbs are the soft leaves and the spices are the harder stuff. So like you say, like the peppercorns, the cloves, the cinnamon bark, it's all the harder things. So, but it's like that, it's like intense flavor and everything.
Yes, absolutely. Yeah, and normally they come from faraway countries, yeah, that's just the way it is. All these really exotic spices come from Asia and so on, India. So
have you ever traveled Asia?
No, I haven't.
Oh,
no, it's on my
man. It would be your heaven. Heaven, I'm telling you. Yeah. So when we lived in Qatar, our most common holidays was Sri Lanka. So
wow.
cinnamon, that's all I buy. And so we multiple times went to all these spice gardens.
Oh.
And oh man, the smells, the everything that is just there. It will be your heaven, I promise you.
I'll be on a constant high. Sure.
Yeah. Okay, let's see. So, does herbs and spices have multifunctional values in the body? And if so, is it possible, even when the herb or the spice is good for, let's say, one system, but that it will actually benefit more than just one system?
Yes, very definitely. I think, I don't think there's one single herb that does one single thing. They've always got a sort of an array of actions, so, and this makes it really interesting. So when I'm going to, for example, I'm just going to use an example to illustrate this. So let's take simple lemon balm. So lemon balm, it's normally known as a sort of a sleeping herb, a calming herb, and so on. But lemon balm also calms the digestive system. So when someone comes to me and they say, I'm really the nervous type, I bite my nails, and I get stomach ache when I'm nervous, you immediately going to think, oh, lemon balm, it's got all those qualities needed for that person. So yes, they are absolutely multifunctional. So when I'm formulating something, it's these little lights going on in my head all the time. Oh yes, we can do this, we can do that, because they are just so usable in so many ways. So if that answers your question, the answer is yes.
Yeah, absolutely. No, I wanted to lay the foundation because, we're going to talk about the body systems and we will talk about specific herbs or spices that is good for one body system. But I don't want people to think that, if we just use this one herb or so, it's only good for this. When you do it, it's going to have other benefits as well. But absolutely, predominantly in that specific system, it is really good for X, Y, and Z. Okay,
yeah, so yes.
Yeah, continue.
No, I think it's what my sort of approach tonight is. I'm going to try and sort of limit all the actions. These actions are going to come up anyway, but otherwise it is going to become so complicated. So I'm really going to sort of mention a herb, but then when we get to a later stage, another body system, I might say, oh, but remember that one, it does this as well. So I'm going to try and get a bit organized, for people to use it. And I think it's important. I'm almost going to look at it as a symptomatic treatment. That's not how the medical herbalist works. But what this will enable the listeners to do is to actually pick herbs according to their symptoms. Because we can't root cause now at this stage. So let's give it a go. See what it gives. Okay. I've never done this before, so.
There's always a first for everything. Okay, so I want to just jump into one thing that I thought is important to ask. Are there dangers to using herbs and spices? Because I think
Yeah.
some people might say, be careful for XYZ, or if you use too much of this, this can be, it can be negative for that. So,
Well, I think you're already saying it. So we've got this wonderful saying in the herbal world, the devil is in the dose. So if let's just look at conventional medicine. If you, for example, have a headache and you're going to take a paracetamol, your headache is going to disappear. But if you're going to chop up that paracetamol into 4 parts and you take only a quarter, it doesn't mean that your headache is just going to go down in intensity. It's simply not going to work. Yeah. So if you've got a major headache and you think, oh, I'm going to take 3 paracetamols, I'm sorry, you're going to feel worse. It's not going to, so dose is extremely important in the herbal world. But there's a lot of herbs, really a lot of herbs that's safe. I mean, apart from perhaps getting a tummy ache, you can eat a whole bucket full and nothing really will happen. But there are herbs. I think it's always good to respect whatever herb you are going to consume. And when we look at kitchen herbs, there's not really much that you can do wrong if you stick to the dose. I mean, let's talk about nutmeg. That can be deadly. If you eat enough nutmeg,
yes,
you can
that's right. Yes, that's right. My
different.
grandmother told me that this, what was it, July when I went, she mentioned something and she said, you need to be careful though. Yeah, so that was, yeah, she mentioned that.
Yeah, but also, I think within reasonable limits, of course, because the studies that have been done, for example, it's been done on rats that has eaten the same amount they've eaten their body weight in whatever. Right. And oops, there's a problem. I'm never going to eat my 70 kilograms of nutmeg,
Yeah,
so
exactly.
Yes, so respect the herbs and don't be ridiculous in doses.
Yes.
So
yes. One thing that I can think of that is a herb oil that I know can also be dangerous is oregano oil. And
yes.
So, I mean, because it's such a potent oil, that is also one that you need to be careful for. So years ago, when I started reading up on oregano oil for, respiratory and for all of those kind of things, I recall reading an article where a mother, the son was very sick. Now, I think was probably 4, 5, 6 years old. And she refused to give him, medications. Didn't take him to the doctor, and she only gave him oregano oil. And he died because it was too much for his little system, and it became toxic.
Yeah, but I think that's also a really good point. So as medical herbalists, we don't use extractions. We use only the whole plant, and like in the therapy where you're going to use essential oils, they can really, really be dangerous. So tonight I'm not talking about essential oils. So if you're going to use oregano or oreganum, I'm never sure how to pronounce that.
Everybody thinks it differently.
Not going to have any problems.
Yeah.
Of course, please bucket full. So yes.
Yes. Excellent. Okay, let's see the next one. Are there any herbs and spices that pregnant or breastfeeding ladies should refrain from?
There's loads, but when it comes to kitchen herbs, not really.
Okay.
But I mean, I can give you a whole long list. I would actually say the opposite. There's loads of kitchen herbs that can really help the breastfeeding or the pregnant lady, like ginger for nausea or fenugreek as a galactagogue to get the milk going. So it's once again back to dose. don't overdo it. Rosemary is one that should be avoided by women with a tendency towards high blood pressure, because it does raise your blood pressure potentially. So yeah, if you're going to use it in a kitchen manner, you know, ordinary use is fine. Just don't overdo it.
Okay, good.
Yeah.
Okay, like you say, the devil is in the dose.
Absolutely.
Okay, right. Let's see, next one. Okay, so are there any herbs and spices which should not be combined because it might, you know, alter its effects?
Well, there are herbs from a purely chemical point of view that you should not be using together. For example, tannins with mucilaginous substances or with proteins, because those tannins are going to bind to the stuff. And so if you're going to make a tannin-rich tea with a mucilaginous thing, it's going to go a bit wonky and you're going to lose your effect. I think there's the obvious things, like don't ever use herbs with the opposite with opposite actions. I mean, I've seen formulations where they've got something in there for constipation, but there's also something in there that can give you diarrhea. So okay, maybe there's a bit of the argument in that is, okay, it's going to create some kind of balance. But yeah, sometimes a good example, don't give someone a calming herb and in the same mixture a stimulating herb, you know. So kind of thing.
Okay, so that would be, for instance, lemon balm with what? What would be the stimulating one? I can't think now.
Okay, so well, then we're going off the track of kitchen herbs, for example. But let's say you're going to use an adaptogen like rhodiola, for example. That's a really stimulating adaptogen. But on the other hand, you got, although those two you can actually use together. But what can we say? It's like using a hot and cold herb together as well. So if you want to use a cooling herb, so say somebody is telling you, you know, I'm really hot all the time. Let's say they've got a hyperthyroid or something, and they've got all these flushing and whatever. So you'll be giving them herbs to cool them down. So please don't go ahead and put in cayenne pepper. You know, it's going to heat them up even more. So don't do that in one mix. So it's very personal, actually.
Yeah.
It's more from a chemical point of view that you don't use certain things. Yeah. So,
okay, so basically, it comes to the point where you say, okay, well, it depends on the symptoms and what you want to address with the herb or the spice, and that will depend on whether you should combine it or not, because they can have opposite effects.
Yes.
Okay, excellent. All right, so I quickly want to run through what the 11 body systems are, and I don't know if we will be touching on all 11 or just some of them, but I want to just mention the 11, and then we can take it from there, which herbs and spices benefits the systems. Okay, so first of all, we've got the nervous system. We've got the digestive system, the respiratory system, the cardiovascular system, the lymphatic system, the endocrine system. We've got the reproductive system, the urinary system, the skeletal system, muscular system, and this one that I really struggle with.
Let's just
it's basically the skin and the stuff, and I don't know how to say it. It's integumentary. I'm sure I'm saying it wrong.
No,
but that system.
I think so. Integumentary.
Yeah. Let's just say, you know, this is where I can claim, yeah, English is not first language. Okay. All right. So which systems do you want to start with? And then tell us about herbs and spices that can benefit that system and how they benefit that system.
Okay, I thought about this one. I think I'm going to start off with a digestive system, because it is actually core to everything. You know, if I want you to take a herb for your urinary system or for your cardiovascular system, that needs to go through your digestion in order to be used. used. So let's start off with the digestion. I think it is core. So something that I'll be touching on throughout all the body systems is actually how we work. We work basically on a tissue level. So our flesh and blood and bone, and we work, we can improve function. So that is basically.
Hang on, you got lost a little bit. We missed what you said.
Okay, so there's the bit of function, so we can improve body functions. Okay,
Yeah.
and we can work on tissue level, so your blood and bone and skin and what have you, real tissue level. So did you hear me? No.
Yes. Yeah. No, it was fine.
Okay, right. So the digestive is an interesting one for both of those. So let's just think of an example. For example, reflux. Let's say you've got reflux. So what happens is acid is pushing up through your esophagus, and it's actually damaging the mucous membrane, and it's damaging your tissues. Those, the epithelial tissue. So you really protect. So let's start with the mucilaginous herbs. The slimy herbs. So you really want to sort of copycat the mucilaginous mucous membranes. You want to protect them, and you can do that so easily by adding things like linseed, for example. So I know people are not going to look at a linseed as a herb, but in my practice, it is an extremely important part of herbal medicine is your mucilaginous substances, and they come in that form, ordinary linseed. So how can you use it? You can, for example, just crush them a little bit, add them to a glass of water, a good teaspoon, and let that stand. And in the morning, first thing when you open your eyes, you just down that glass of mucilaginous wonder. It is so brilliant for those mucous membranes, and that goes for throughout the body. Also,
so would that be soothing, or will that be soothing for the mucous membranes?
So soothing. So it's going to give the damaged tissue the opportunity to heal. It's covering it. It's going to give it that lovely little layer of slip. So when you, for example, going to eat a dry biscuit and there's no mucilage there, no mucous membrane, I'm sorry, it's going to go really hard. So it's very well worth looking after your mucous membranes. It goes much further than that. You've also got mucous membranes in your nose and in your sinuses. And it works for all of those. So anyway, as we continue.
Okay. So quick question on that. There's a couple of things that I think that I know of that becomes like quite jelly when you make them. So basil seeds are one of them. And then there's psyllium husks. Psyllium husks, and then slippery elm, and there was one more, chia seeds. So are all of these like beneficial for the mucous membranes?
Absolutely, they are. They really are. The ones that you've mentioned now, for example, the basil seeds, and they've got qualities of their own. So linseed, for example, it's also got qualities of its own. Chia seeds has got qualities of its own. So depending, if I've got a patient in front of me, I'm going to sort of choose the right one for that patient. But linseed, for example, is the middle of the road. It'll work for everybody that's got a problem there. It also, when you've got that reflux, then just by the way, so your stomach content pushes through your esophagus, but what the linseed also does, it sort of just puts a layer on there, and it really struggles to go through that valve there. Okay. So it's really, really good. So the other issue that you've got is is of course your epithelial tissue, the cells under that mucous membrane, which is absolutely, it's so important because that is where thousands of little blood vessels and all sorts of things are located. So you really need to take care of them, of the cells there. So you can do that by using tannin-rich herbs. Maybe also not looked at as a herb, but common black tea is so good. A tannin is actually what they use to tan leather with, to make leather.
Yeah.
So it's going to bind to the proteins in your epithelial tissue, and it's just going to sort of pull things nice and tight. Because if there's inflammation, for example, it's going to go all wobbly and sloppy. So you want that to be really nice and tight. It forms a kind of a watertight barrier. Now, we are a living being, so it's not going to last forever. You have to constantly do that because our body renews itself. But so that's very, very good. So if you have, for example, got a cold, drink tannins as well, because it's going to just tighten up that barrier so that viruses and stuff cannot go through there and cause more inflammation. So that's an important one.
Okay.
Have you got any questions?
No, not at the moment. So for the digestive system, what other herbs and spices would you recommend to improve digestion, or that benefits the organs itself? I mean, if I'm thinking of the digestive system, I'm thinking liver, and that is just my favorite organ in the body.
The digestive system is vast terrain to cover. Yeah. I think we're going to need of these.
Yes, I agree.
To cover it all. But okay, let's just go to very common. You're really gassy and that kind of thing. So in that case, think fennel, think aniseed, think that aniseedy kind of taste that you find in so many herbs. That is your go-to. We call it a carminative. It just drives wind right out of your system. It is fantastic. So you can make a tea with it. You can use it in your curries. There's so many ways to use it, but always remember, if you're going to heat it up, put a lid on, because all those beautiful volatile oils just escape into thin air if there's heat. To cool and use that water, that sort of condensation as well. See to it that is what you take into your body, so it drives out wind.
Okay. Just one thing, can you mention those herbs and stuff again, because you broke up for a little bit while you mentioned them, so let's make sure we didn't miss any.
Okay, so everything aniseed. So if you're going to think of fennel, of caraway, of cardamom, oh, what a brilliant herb. Yes, those kinds of aniseedy things, they are very, very good at driving out wind. So they're carminative.
Yeah.
And they also...
It makes me think of, when you go to an Indian restaurant and after you had a meal, they give you the seeds to eat. And that is to support digestion and, to reduce wind, gas, so for all of those purposes.
Yeah, and they contain lots of essential oils. I mean, that's why they're so beautifully aromatic. And those are also like spasmolytics or antispasmodic. So if you tend to have a bit of crampiness, that is also going to work. Babies with colic, fennel, go to fennel or caraway or cardamom. They're all great for babies.
Okay, and then how would you give that to a baby? Will you just soak it in hot water and then make like a little tea, or what?
Tea, just an ordinary tea, just a very ordinary tea. In practice, I make a glycerite. You soak them in glycerine, but you can also do that in honey, for example. So you'd just pour over a little bit of water.
Okay. Okay, we'll let her know now that she's a little bit offline. So just in there. Oh, I hope she doesn't lose connection. Oh no! Oh gosh! All right, let's see. I think Irma's internet connection is not very good where she is. So let's invite her again. I'll have my tea while I'm waiting for her. Okay, so Irma's internet just cut out, so we are waiting for her to rejoin. I hope everything will be fine. So I hope she can join soon. We've been having quite some technical difficulties tonight with this live. Yeah, so if and when she gets back, we will try to rush the discussion maybe a little bit to get through everything. She had a lot she wanted to share, so just hang in there. Okay, and let's try again. I hope she can make it. Baby girl. My doggy wants to come in. Oh, hi, guy. So sorry about this interruption. Okay, so no, we didn't start at 5. We tried starting at 6 o'clock. So I'm just answering a question. We tried starting at 6. We had multiple difficulties with the internet, and then only at 6:30 we finally started our live. So, but I think you might be an hour behind us. So 6 o'clock our time would have been 5 o'clock your time. So yeah. Oh, she's back. Hallelujah. Hi.
I don't know what we're doing.
Welcome. We've been chatting with each other here online. So Ahmed is asking, where are we from? So we are both actually from South Africa, but we're both living in Europe. So, okay. So that was just a question that was here in the question box while we were waiting for you to, join us again. Okay, so Irma,
Okay,
what I've decided while you were reconnecting, maybe what we should do is, let's look at the body systems and then just mention the herbs that is good for each body system. So this will go a little bit faster, otherwise it's going to take really long. That's if we can connect. Oh man. Well, this is really sad. Well, that's life with technology, guys. So if you have questions, please leave them below so we can answer them as we go on. Oh, she's gone. We'll have to try to get online again. I think her internet is poor where she is, probably located in the house. So it's okay. Okay, let's see. Sorry, so Louise, you just joined. Irma's internet connection is really poor, and so she seems to struggle to get online every now and again. Okay, we try again. Let's see. If you have any questions, please leave them in the box below so we can get to it as soon as possible. Okay. For headaches, yeah, we'll ask Irma. She mentioned something earlier, but let's confirm with her. I guess it should also depend on what is causing the headache. If it's a tension headache or if it's a migraine, it's a hormonal headache. I think it depends on what's causing the headache and how you should probably address it. I think Irma's struggling with her internet. Let's try again. Okay. All right. So there we go. There she's back.
I don't know what's going on.
Somebody left you a question here. I made an attempt of answering it, but so the question was, what is a good herb for headache? So I took the liberty and say, well, it really will depend on what is causing the headache. Am I wrong?
Yes, it is. So you get digestive headaches, tension headaches, etc., etc. So you actually going to address your
So
root
it really
cause.
depends on the cause of the headache, how to appropriately address it.
But there are herbs, however, that can really just take off the edge. I'm not going to say that it's going to do the same job as a paracetamol or whatever, but for example, mint is a really good one. It tends to work better for digestive headaches, but it also just takes off the edge of a tension headache because of, it's really good. And also, this is not a kitchen herb really, but lavender is great. Just lavender tea. So think combination mint lavender tea. That could really help.
Okay, well, that's good to know. Yeah, I was thinking, if it's like blood vessels that is constricting because you probably had too much caffeine or something, I was thinking of probably more like something like cayenne pepper or something like that can, just open up the blood vessels. But yeah, that is a bit of a wild one.
You're going to blast them. So yeah, if you can handle it, try it. But,
nowadays, you can buy them in capsules. So
yeah,
you don't need to burn your throat all the way down.
No. But what they do is they sort of blast open your vessels, your blood vessels. So they're going to dilate at quite a rapid
dilation. Okay,
and that could hurt.
Okay,
that could really hurt. So yeah, and it also pushes up your blood pressure.
Okay, yeah,
not massively, but it can. Very short of duration, but it can push. Yeah.
Okay.
Can affect your blood pressure. So I think mint and lavender is a great way to go for just a ordinary headache.
Okay, perfect. Okay, well, now that you are back, I hope the internet is stable. So we were discussing the digestive system. Okay, and herbs that is benefiting the digestive system. So run us through with a list of herbs that is beneficial, and then let's just give like a basic summary as to why, so we can get through.
Okay. Right, so let's just talk about digestion. If you've got a feeling your food is sitting in your stomach and it's not going anywhere, you would want to help that food get digested because your body needs it as building bricks. So bitters is the first thing. So think bitter herbs, think bitter foods, things like chicory or olives or those kind of things. It just gives that message to your brain, there's digestion that needs to happen. So that is a really good one. Let's then think about the gallbladder and pancreas. And so if you want fats to be better digested, you can think, for example, a good one is cinnamon. That's a really it's also lipid lowering. So if you've got if you've got cholesterol, yes, that's good. And also it lowers blood sugar as well. And there's certain herbs that really gets the bile flowing, and all the bitter substances to break down fats. Basil is a great one. Actually, all those like basil and coriander, those are the ones that's going to get those digestive juices flowing. So Right. Also things like, yeah, you want to improve your digestion because that is your intrinsic factor, for example. It's so important for vitamin B12 to be absorbed. And so your stomach really needs to be in a good condition. So it's just think of everything, you know, your tissue needs to be good, your your function needs to be good. So okay. Right, so the liver, everything bitter. Always think bitter if you think of liver. So in the world of medicine, herbal medicine, we're going to use bitter herbs like psyllium, that is milk thistle. That's the well-known one. So it's not something that you have in your kitchen. Milk thistle, yeah. If that gives you an idea, you know, you can buy bitters. You can buy Swedish bitters, for example. That's really, really so good for digestion and just to get that fire going and things absorbed. And then we are going right into the intestines. Your small intestine and your large intestine really needs to be in tip-top shape because it's also where things are absorbed. Your large intestine is such a hub for your immunity, so it needs to be great. It needs to be in good condition. And what are you going to use for that? Once again, back to the mucilaginous stuff. So that linseed that I spoke of. Yes. And also fiber, things, fibrous things. That is food for your gut bacteria. So yeah, those are all things. They work together. So it's very. I find it really hard to look at these herbs as a sort of a standalone. You know, it's that whole process that's important. But no, depending on where your problem is, maybe you can pick out a few with what I've been saying here. So.
Okay. All right, so let's move on. Cardiovascular system is another important one to discuss because I think this specific with ladies that is like, you know, entering their hormonal shifts and things. There is the concern of cardiovascular issues. So which herbs and spices can we use that we can make sure, okay, that our blood pressure stays in normal range, that our kidneys are looked after and everything. I mean, for cardiovascular disease, we still need to look after our kidneys. And, you know, so for the blood vessels and for the heart and all of those. So.
Okay, right. So let's start with the blood vessels. Something really brilliant for the blood vessels is blueberries and blackberries. Everything that contains that sort of purple blue pigment, dark grapes, that kind of thing. They contain stuff that is called proanthocyanidins, and they are just brilliant because they sort of keep your arteries clean, you know, so that there's no buildup of plaque of cholesterol and that kind of things, atherosclerosis. So that is very much part of the whole cardiovascular scene for menopausal women, you know. Also heart function. That's a bit of a difficult one. There are herbs that regulates heart function or can help. I mean, it's very soft, but that doesn't really fall under kitchen herbs. It's a bit more specialized, but something that you can buy perhaps in your natuurwinkel. What's that called? Your
natural
sort of,
health
shop is hawthorn. That's a great one. So hawthorn berries for the actual heart muscle, and hawthorn flowers and twigs for the actual heart function. So the other things is your circulation is also, I mean, our heart is our pump. So we need, it circulates things. And why do things need to circulate? It transports oxygen and nutrients and what have you. So what is good for that? Cayenne pepper. So it just, and ginger. It's also another great herb.
Isn't garlic supposed to be like king of the for vascular function and to prevent plaquing?
Yes, but I think you need to make so let's start off with, if you're going to use garlic raw, it's a really good antiviral. That's for all your microbes and your stuff. But if you're going to use cooked garlic, that is going to contribute to heart function. It actually becomes a substance. Garlic is a really amazing plant. It sort of changes. It's got these enzymatic processes going on in the garlic, and so it very much depends. If you take your garlic 10 minutes after crushing it, it's something different to that raw garlic. So it's quite a complex thing, but I mean, garlic in all shapes and forms, go for it every day. It can only benefit you. So yes, for cardiovascular disease, for that build-up atherosclerosis, absolutely. Cholesterol, it's cholesterol lowering in a big way, and it lowers blood pressure as well. Yeah. So I know my great-great-grandmother, she ate her little garlic every day of her life.
I know, isn't that such a tradition with the older generation? A garlic a day.
Yeah. Absolutely.
Yeah.
Not an apple a day. Eat your garlic a day.
Yes, it's true. Yeah, exactly. So just one thing that I've personally experienced. So I tend to have low blood pressure, and yes. I usually take raw garlic for a cold, flu, bacterial infections, blah blah blah, all of those kind of things, right? So one thing that I've noticed for people like me who have low blood pressure, you cannot take too much garlic, and also not for a too long time, because of the effect that it actually lowers blood pressure even further. So that is, it can cause it dangerously low.
Okay. Yeah, well, I've never experienced that in practice before, but I do believe you, because it's also blood thinning, so yeah. It is quite potent. So yes, if you are prone to that, well, you said it.
Yeah, well, that was my personal experience, and that's why I had to go. I mean, I was on day 4 of taking 1 clove of garlic, once in the morning, once in the evening. And I became dizzy and lightheaded, and I felt like fainting, and I was nauseous. I'm like, what the heck's going on? And then I realized that it's the garlic that I've been taking, and it's just lowered my blood pressure way too much. So yeah, so for people that is prone to low blood pressure, careful with garlic.
Okay. I'll remember that one as well. Okay. So yeah, anything more on the cardiovascular system? What do you think?
If you're ready to move on, we move on. Okay.
Let's move on.
So, respiratory system.
Okay. Oh, lots of things you can do. Well, not so many things you can do, but there's a handful of herbs that can really just take you to a different level if you've got a cold in getting better. So the first thing I'm going to mention is garlic. So it's a fantastic antimicrobial, antibacterial, but raw garlic.
Yes.
So you've got to chop it up and put it into honey, or whatever way you'd like to, but that honey, that garlic needs to be raw. Then the other thing is thyme. That is it's so amazing. Thyme is antiviral, antibacterial, the whole katoot, but it also loosens phlegm, so that's a really good one. So if you've got a really nasty, sticky phlegm, it's going to loosen it.
Oregano?
That can also be used. It's not as potent. It's got that same kind of ingredients in there. So all of these, we must remember, these herbs, oregano, thyme, rosemary, they're all Mediterranean herbs. So they've all got something. I'm not going to say similar, because that would mean I'm not doing justice to them for what they are. Yes, I'm going to whisper that there's something similar in all of them. They all contain essential oils that are really potent and exceptionally good for. Well, you can also apply it in the digestive system.
Okay,
They're
and
really useful. So they're anti-inflammatory properties. So if you've,
what
even if you've got
about
cystitis, for
what
example. Mm.
about mullein?
Mullein.
Say again.
Mullein.
Yes.
Yeah.
Well,
So,
I just
okay,
don't know
so
how to pronounce these things.
it's mullein. So Verbascum tapsus. It's of course not a kitchen herb, but I use it very often this time of year. So the flowers, you can soak that in oil, and you can use it as an oil for earache. And the leaves for any chesty situation. It's going to loosen phlegm like you have never seen before. They are it's brilliant. It's really good. It's one of my standard go-tos whenever somebody's got a real tight chest, phlegm, green snot kind of thing. You definitely mullein. It's a good way to go.
Will that help people with asthma?
It could certainly contribute. I won't use it as a standalone, but it as part of a mixture, absolutely. Some people also smoke it. I haven't tried it. I've never smoked in my life, but there's people that swear by it. So yes.
Okay. All right. I wanted to ask something. What was it? All right. So, and when you make a tea, so with tea you use the flowers, right? Or the leaves? Which one for the teas?
No. Actually, the flowers, that should be noted. That can be toxic if you're going to use it internally. So you can only use it externally it's a bit of an analgesic. For earache, and it's a bit of an anti-inflammatory as well. So only externally the flowers, but the leaves are fine. You can use those. Yes.
Okay. All right. Anything else for the respiratory system you can think of that you would like to mention?
Oh, mint is also a good one. It's such a common herb, but it just opens up all sorts of passages. You know, if you've got sinusitis, it's such a nice herb to. Yeah, if you're having a cup of tea and you just breathe in all those good volatile oils, it really opens up things. So it can make you feel better.
That makes me think of eucalyptus. Eucalyptus
very much
so common used for that.
Yeah,
or I mean,
it's that cancerous, mentally kind of thing that opens.
Yes.
So
absolutely love eucalyptus for that. So I see there's a lady asking about sage and sore throat. What for the throat?
Sage, brilliant. Sage. So let's get back to the tannins. Tannins, the one that you use to tan leather with. So if your throat is really swollen, inflamed, red, floppy, awful, sage is the way to go, because apart from the anti-inflammatory properties, well, it's actually part of the anti-inflammatory scene. It's going to tighten those tissues, and those viruses or whatever is floating around there can't get in. You know, they're going to have to stay outside. You can just cough them out. So yes, absolutely. If you've got a sore throat, gargle with sage. Brilliant.
Wow.
Definitely.
Okay. That's the first I heard that one. That's really good.
Sage, I must also, while we're on the topic of sage, sage is an antihydrotic, so it means it makes you stops sweating. So menopausal women and sage is synonymous.
Ladies,
so
take note.
Very useful herb.
Oh, that, and I say, ladies, take note.
Yes.
Because a lot of my followers is in that age group, so I'm pretty sure they will appreciate that bit of insight. Okay,
Yes.
so we looked at the digestive system, the respiratory system, cardiovascular. Do you have anything for the nervous system?
For the nervous system, we are once again going to go to the stuff that contains a bit of volatile oils, you know, because the volatile oils seem to just reach the sort of things it should, you know. So things that can be really calming for the nervous system is lavender. I mean, good old lavender.
Okay.
There's not much kitchen herbs, there are things that can have a real influence, like nutmeg. So you can use nutmeg as a sort of a painkiller via your brain.
Okay.
Let's put it that way. Um,
So nutmeg helps you to sleep, right?
I beg your pardon?
Nutmeg can help you to sleep.
Yes, it can.
So
Yeah, it can.
that means it relaxes. So I mean,
Yeah,
could that
via
be
the
good
nervous
for the nervous
system.
system? If it brings that relaxation, would that be a good one?
Yes, it's a good one, but that's actually, if you're going to think of oregano or marjoram, those are things that's going to sort of, yeah, they're really going to calm you. They're going to work on your parasympathetic, your sort of rest and digest kind of system. It's going to bring you down, calm you.
Okay.
So we're back to, yeah. So all those herbs, really useful.
Okay. Let's look at something I really would love to talk about is the lymphatic system. Do you have anything to help the lymphatic system for people that, they want to start doing the lymphatic massages or something? But is there something that we can do from a herbal perspective to help clear out the lymphatic system?
I'm going to get you guys foraging now. So kitchen herbs, no, not really. In a very minor kind of way. But your real go-to for your lymphatic system, and it's all over, is Galium aperine. So what is that? It's common old cleavers. It is the bane of many people's lives in their gardens because it just takes over. Sticky willy is the funny name for it. So yeah, sticky willy, I mean, it is unbelievable. You will immediately recognize it when you see it. It sticks to everything. It's this long little shoot with a lot of little leaves, and it sticks to everything. So you actually can't miss it. But that one is
so sticky.
Wow!
Willy, is that actually literally like what I will find it on Google as?
You can try, but I would say try cleavers. So you can try both, so that you're sure you've got the right plant.
Let's start with
why we speak in Latin, in Galium aperine, then you know you've got the right plant.
Yeah. Let me just say plant. Cleavage plant. Okay, here is something. Sorry, you can continue talking. That's fine. I'm pretty sure everybody would love to hear what you're saying.
Okay. So another I'm just thinking sort of another great herb for the lymphatic system is calendula. So calendula flowers, we also used to a lovely calendula cream or a nice little calendula salve. But if you take that internally, it also gets that lymph flowing. So very good. So that combination, they work slightly differently, but they are really so good for the lymphatic system.
So can you take that internally? I didn't know because I just bought. Hang on, which one did you say? I might have the other one in mind.
Calendula. So yeah.
No, sorry, I'm thinking of camphor. I was thinking of camphor oil. Okay, so it's not the same thing.
No, but calendula. You asked me about the multifunctionality of herbs. So calendula is one of those. It gets the lymphatic system going. It is wound healing like you cannot believe. It is anti-inflammatory. It's great for the female hormones as well. So again, menopausal women, perimenopause, calendula definitely. It's a good one.
So the lady is asking, calendula tablets, powder, or tea?
I would say use tea. So in practice, we're actually going to use tinctures, and it's much more intense, of course. It's much more concentrated. But that takes out a different part of that calendula as well. But with the ordinary tea, you can really go a long way. Just tea. But use a good bit. It's quite bitter as well. So that's another attribute, very good for the digestive system as well. And internally, also healing. So if you've got an ulcer, or if you've got reflux and your esophagus is really hurting,
Mm.
Good one to go to. Wound healing, it heals, you know, it's great.
Huh.
It's a favorite of mine. So,
Okay.
yeah.
Okay.
Not very
Okay.
tasty though. It's not very tasty.
No,
It's
it makes me
quite bitter.
think of dandelion. Dandelion is, I mean, it's so
Yeah.
powerful, but it's just not it's not tasty at all. Okay.
Funny dandelion. Yeah. Okay.
No, no, no.
Right.
Continue,
So
continue. I mean, if I think dandelion, I think liver.
dandelion is great. So it also depends on which part. If you're going to use the root of dandelion, we are going to sort of, my attention immediately goes to men with a benign prostatic hypertrophy.
Okay.
But if I think leaves, it's a diuretic, so it's going to make you pee.
Nice.
In French, it's called dent de lion, dandelion, the
Oh,
teeth
that's
of a
so much
lion.
nicer.
And so that's the one explanation. But the other thing is they call it pissenlit. So pissenlit, it means to wet your bed, to pee in your bed. So it really gets you peeing. So
Nice.
what are we thinking then? Why would you want to make someone pee? Someone with a bad bladder infection,
Yeah.
and someone with, for example, rheumatoid arthritis or any sort of musculoskeletal condition. People with gout, that's a great one for that as well. So
Edema,
it
I mean,
gets
if it's a diuretic,
edema.
yeah,
Absolutely.
perfect.
Absolutely. Yes. So yes, and the flowers are high in beta carotene, so it's good for the eyes. You know, it's a bit of an antioxidant for you, and of course the bitter for the liver, and it's a bit laxative as well. So constipated, dandelion leaves, and they're very nutritious. Just by the way,
Exactly.
and they lower blood pressure. You know, whoa, they're really great.
Nice.
So,
Yeah.
but they're soft. They're nice and soft. They are not hectic herbs. I mean, you can have quite a lot of dandelion, and they're easy to find. I mean, you don't need to keep them in your kitchen. They just grow everywhere. So go for it.
Just wash it before you use it. A dog might have pissed on it.
Absolutely. Don't pick it there where dogs pee, and so on and so on.
Oh my gosh, I'm sorry. I had to say that. That was like my first thoughts when I saw dandelions growing wildly and everybody was walking their dogs. Okay, all right. So, what about the reproductive system?
Reproductive system. Okay, so let's talk female reproductive system.
Yeah.
Actually, we have talked about it. So there's your sage. Okay, not menopause. Let's get to the reproductive. So, yeah.
Anything good for the ovaries? Anything good for the uterus? Anything now for that you have in mind?
Yeah, well, we're going to, as I said right in the beginning, let's think tissue level. So your uterus is also made up of flesh and blood, you know. So you're going to, for example, there's a herb called centella. It's not a kitchen herb, but that is so good for on tissue level, for example, the uterus. So yeah, that's a bit of a specialized field. You know, there's not much kitchen herbs or well-known herbs that you can use for that. I'm thinking yarrow. That grows.
So what does it do for
wildly
the uterus? I mean, what would it do for the uterus? Will it encourage flow? Will it reduce cramps? What type of effect will it have?
It depends. There's, for example, Capsella bursa. It's a tiny little plant, and that could stop bleeding. If you have very, very heavy periods, you can use Capsella, and it's going to stop it. You can use lady's mantle. That's quite a well-known one for heavy bleeding. Herbs that work really well in combination with other herbs for painful cramping. So it's that time of the month and you have really got a miserable feeling in your pubic area, you know, then something like ginger, that's great because that just increases circulation to your female organs and oxygen is always great. You know, it just, yeah, softens
So
things.
you mentioned earlier that ginger is also a warm herb.
Yes.
It increases heat. So would that be one of the reasons why it will also, kind of almost soothes the uterus?
It could most likely contribute, but I think it's more the circulatory action of it. So it's going to just get things flowing. You know, that stagnant blood sitting there. If people have got a lot of clots, it's going to thin the blood as well. So
That's good to know.
thin blood. You know, I'm now just thinking off the top of my head. It's not that I've got the study in front of me, but I can just imagine it doing so. But it is really, really good when you have menstrual cramping, pain, heavy bleeding. So yes.
Okay. All right. Okay, so is there anything else for the uterus or ovaries or something that you would like to share, or maybe for the male
For the male,
reproductive system?
for the male reproductive system, maybe you know this, but pumpkin seeds, that is fantastic
Yeah.
for prostate problems, for example. You know, if you as a male start eating your pumpkin seeds early enough, you know, you're really going to, yeah, you're going to be better off than someone who hasn't been taking it.
Yeah.
You know, it protects it. Yeah, it just sort of
So
sustains things.
for the pumpkin seeds, is it mainly because of the high zinc content for the men, or is there other reasons as well?
It could be all of them. It's so nutritious. Pumpkin seeds are really nutritious, but they've also got a little bit of a lot of seeds and nuts contain some hormonal action. And it's not copying any hormones, but what it's for, well, in the female case, I know exactly. It sort of binds to the receptors. It's got the same kind of chemical structure, and it can bind to these receptors, and it can sort of imitate the hormones that at a certain age for women, but yes, also for men, start deteriorating. It becomes less, you know, and that's when function starts going. So absolutely, it can play a really good important part in reproductive.
All right. So let's quickly look at the urinary system. We kind of touched on it a little bit, but
So, the urinary system, what is the bladder? The bladder is a sac. Inside that sac, there's a mucous membrane. So just back to the mucousy stuff again. So your linseeds, you mentioned slippery elm. That's really a good one as well. But a really interesting one, if you take the leaves off a corn, a cob of corn, a corn cob, whatever. Those hairs.
Yeah.
Have you seen it before?
Yeah.
Like a hairy bit.
I come from the cornfields.
Oh wow. Those that like we call it corn beard.
Yeah.
You know, that corn beard is fantastic for the bladder, male and female bladder. Wow. So it contains mucilage, so it's going to just take care of that mucous membrane, and it's also an anti-inflammatory, really good, and also a little bit diuretic. So if you've got a bladder infection, for example, you really want to protect the side of it. You don't want nasties to get through into your tissues. You really don't want it to get to your kidneys. This is going to take care of it. It's also soft herb. It's also something that I won't use it as a standalone, but it can help just in the sort of early beginnings of, you notice there's something. So, yeah, good one. So never chuck that away ever again.
Wow,
keep it.
That is really interesting. Never heard of that before. Okay, all right. So I am thinking now, urinary system. I'm thinking kidneys. Anything specific you would want to share?
So kidneys. It's good that you should mention the kidneys, because the kidneys is something that we in the herbal medicine we don't really treat the kidneys. We send people to the doctor.
Okay.
There's very, very few herbs that is really effective for the kidneys. Of course, once again, it's going to boil down to that whole scenario of tissue and mucous membranes, and it's a filter system. So you're going to think diuretic, so that things just move well through your body. You're going to think blood pressure. You keep your blood pressure right, because the pressure on those poor kidneys, once, they are supposed to be regulating the moisture in your blood. So you really want to keep them in tip-top shape. So think mucilage and think tissue. So also centella, but that's not a kitchen herb. It's difficult to find.
I don't mind if it's not a kitchen herb. I mean, I'm thinking of something like for people that might be slightly more prone to stones. I'm thinking of like Chancapedra, which is called the stonebreaker.
Yes, absolutely. But we will use that in our in practice. But that's not something you're going to say to someone. Go out and buy that, because you don't. No.
Oh, I
no.
bought it for myself, and because I started when we just moved here. The water here was full of calcium, and I started getting kidney pain from, using the tap water. I mean, at least our tap water is clean compared to, other places in the world. And after a couple of months, I realized, this is the only thing it can be. It must be the tap water. So I said, I'm going to start buying, bottled water. So I'm on bottled water. The rest of the family is on regular water. And then during that specific time, I started taking Chancapedra, and I felt within a day or two, I felt a relief from kidney.
Okay.
So for me, that was not something that I felt. I mean, I could buy it on Amazon, and I didn't feel that is something that I need to be weary of using, because, I mean, once again, it's kind of gentle. It's not like this massive thing. I mean, that was my experience. So for me, it was a very good experience.
Yeah, so if we're going to treat someone for kidney stones, for example, I mean, they've got to go off to their doctor, but because it can really damage your little tubes, all those tubules, you need to be really careful. You need to know what you're dealing with. You don't know if that stone is this size or this size. But I think the devil is in the dose once again. So we use really big doses. But anyway, I'm really happy for you that it worked, because Chancapedra is a wonderful, wonderful herb. So yes.
Okay.
Stonebreaker.
Yes. Yeah. So that was just something I scanned through some documents, and I caught that. I'm like, wow, that a plant would actually be called stonebreaker, that from ancient times they knew exactly what to use it for, and that it's beneficial to the kidneys and so on. I mean, that was just that they basically called the plant according to its function. So it's just amazing.
Yeah, I'm just also thinking another very, very great herb for kidneys and for bladder. It's an antiseptic. So if there's any form of inflammation, any form of kidney inflammation or bladder, juniper berries. You can make a tea of juniper berries. It's a great antiseptic herb, and you can also use that topically. So if you've got a septic wound, very, very good. So yes, and it's also diuretic. It's also going to make things flow a bit. So yeah.
Okay, that's really good.
No, that's a good one. So yeah.
All right, so let's look at the skeletal system. Any herbs or spices or something that can, increase bone density or stuff like that?
Okay, for bone density, we would normally look at good old nettles. So nettles is really so nutritious, and it contains a bit of silicium. And then there's horsetail. I don't know if you've heard of horsetail. The Latin name is Equisetum arvens, and it looks a bit like a skeleton, and it's so rich in silicium. So you cannot take that long term, because it can become quite irritating to the kidneys at some point. We also use it for the kidneys, by the way. But it's great if you've got osteopenia, osteoporosis. Yeah, that is the go-to herb.
Okay, so
Definitely
horsetail.
gonna horsetail.
Huh.
Really good one.
Okay. All right. All right. Okay,
Yeah,
let's see the muscular system.
okay, so in the herbal world, we talk about the musculoskeletal system. So they sort of hang together. So whenever you've got, for example, let's talk about an achy joint. Let's say you've got a really sore shoulder. So there's muscles and there's bone involved there. And what is going to happen? Your immune system is going to rush there, and it would want to sort of clear all this debris, because wherever there's inflammation, there's waste.
Yes.
You know, so what can we do is we can help that waste to just go. So we're going to use those same diuretic herbs that you're using for your kidneys to get these things, and lymphatic herbs as well.
Yeah.
So all that debris needs to go out to clear, to actually assist the immune system in making these things happen, you know, and faster. So yes. There's also very few of the common, easy to find herbs. That's great, but the well-known ones are arnica. You can use arnica if you've got a lot of pain, and you can use symphytum or comfrey.
Yeah.
You cannot take it internally ever. Don't do that. I know some people do, but I would not recommend that. It's very bad for your liver. Yes.
Good.
But comfrey is fantastic if you use it topically. Its English name, or its common name, is called bone set. So if that gives you an idea, so if you've got a broken bone of some kind and you make like a compress or something with either symphytum root or even the leaves, you are sure to heal faster. And I speak from own experience.
Oh, wow.
I had a great fall, breaking a wrist, 2 ribs, and an elbow, and I healed like in lightning speed.
Wow.
You know? And I'm a menopausal woman, so they were very, very impressed at the hospital. Wow, these bones have healed really quickly. So, yes, symphytum, comfrey.
Wow. Okay. All right. So then let's see. Did I miss anything? Okay. And then this word that I don't even know how to pronounce, the integumentary system, which is basically the skin. Yeah, the skin and everything just below
the nail.
Yeah.
Yeah, so important to take care of the skin, because I mean that's our barrier between the outside world. That's what separates us from the rest.
Yeah.
And I was actually reading about, I've got this fantastic little book here called the Remarkable Life of the Skin. You know, and there's quite a debate whether the skin, you know, so many medications, topical medications are made to be absorbed by the skin. And even in the traditional herbal medicine, you know, doing things like foot baths or lying in a magnesium bath, are those things really absorbed? And there's actually really little proof, except when they sort of chemically blast your cells open for these things to be absorbed and into your bloodstream. But usually things only sort of absorb into the top layers of your skin. So anyway, okay, that said, that's completely beside the point. Things that you can do for your skin is moisturize and keep it soft and toned. And you can do that with something as stupid as oats. You lie in an oat bath. Oats is calming.
What about aloe vera? You haven't mentioned aloe vera once.
Aloe vera.
I mean, that is like everybody knows aloe vera. I mean, you can take it internally, you can take it externally. It's like, it's good for so many things.
Yeah, aloe vera, my goodness. Yeah, I can't use it at all. I am so allergic to aloe vera. I'm not allergic to anything in this world except aloe vera, very strangely so. So, yeah,
Oh,
it's
that's
sort of
sad.
not in my. But yes, absolutely, aloe vera is great. So, for
Wow,
so
okay.
many things. But,
Okay.
yeah. So, just back to the skin. So, if your skin is itchy, do you know the herb called chickweed?
Yeah.
So, chickweed grows like weeds, chickweed. Um, It's
Okay.
fantastic for itching. So sometimes you get this neurogenic itching. People think, there's no sign of anything that should be itching, but they're itching.
Yeah.
And even that, I don't know. Is it like the placebo effect? I don't know, but it really works. I've seen that with
Wow.
my own eyes.
Wow.
So anything in the lines of urticaria, if you've got eczema, if you've got any itchy condition, an insect bite, that is the go-to. So I that's another foraging one. So you should go out for cleavers or sticky willy and go look for chickweed as well.
Wow. Okay. Well, that is fantastic. All right. So let's see. Yeah. Okay. All right. We covered that one. So I'm just quickly going through the questions here. No, we covered that. Okay. Now, so seeing that we've already had a pretty lengthy discussion, I want to close off by asking you, what is your all-time favorite herb or spice and why?
Oh, it's a question I dread because we're going to sit here tomorrow.
There's too many.
No, my all-time favorite, and it's something that I used for myself, is Boswellia serrata. It's not really, it's one of those that we're going to call a herb, but it's not really a herb, it's a resin.
Okay.
And comes from Ethiopia, and also there's another variety growing in India, but it's actually incense that you burn.
Yeah.
So that to me it's the most incredible thing because it's anti-inflammatory. It works for autoimmune diseases. It's an analgesic, so it's a painkiller in a certain way. It works for asthma. It works.
So is this
it's brilliant.
You
So
take the resin and you burn it, and it has all these effects.
so that's no. You would take it internally. I put it in capsule. Yes.
Okay.
But the rest of the herbs, you know what? I've got this selection in my kitchen, and I'm in love with all of them. They are just, they're my friends, they're my team, So it depends in which mood I am. I love my plants, my herbs. So yes. Did I answer your question?
Absolutely. I knew you won't be able to pinpoint it to one thing. I had to test you, though.
Oh, that was what it was.
I just see what the medical herbalist will say is like that one favorite thing. And I'm like, I know that is impossible to answer.
It is. It really is.
All right. So, Irma, I would say everybody in Europe, if they want to contact you, well, it will be easy for them to, get you on here and then private message you and get you your details. If they want to work with you, if they have symptoms or whatever they want to work with, and they want to take a natural approach and rather give some space for natural medicine instead of allopathic medication. So Irma is available. So Irma, do you also then work online with people outside?
I do. Yes, I do. Yes, I do. I prefer I prefer
in person.
face because, you know, I examine people, I take their blood pressures, I make them pee in a little pot, all kinds of things. But if people are really far away, it's no problem at all. You know, we take it from there and we do our very best. And actually, it works really well. So that can be done. Absolutely.
Okay. All right. So that can be done. That is fantastic. Okay. Well, Irma, thank you so very much for your time and all the information you've shared. This was really lovely. I'm really sorry that about the technical difficulties we had in the beginning. But I'm just happy we pushed through, we made it work, and that you had the opportunity to share, and that people can also just, you know, get to know what you are doing, and that they can contact you. Because I think you mentioned once you are the only medical herbalist in Belgium, and then one of 11 in Europe, correct?
Yeah, I think we are, I'm not quite sure. I think we 11, 12, 13 medical herbalists at this stage. But we all belong to, this is maybe just nice to mention, we belong to the National Institute of Medical Herbalists. So they're based in the UK. But if you should be looking, if you're in any other part of Europe, you know, go onto this website, Medical Institute of, whatever, National Institute of Medical Herbalists, and there they've got a find a herbalist sort of section. So we are really, you know, there's people in even in Finland, I think. So there's a few. Yeah,
Okay.
it's about. So yes, and I am training. I'm a clinical trainer for Hartwood, which is one of the most important schools for training medical herbalists at this stage. So we are coming on like a tsunami. We are increasing in number. There's a lot of students at this stage.
That is fantastic.
Yes,
that is really fantastic news. Okay, well, everybody, you had the privilege of meeting Irma tonight. We had a lovely discussion. Thank you for all the wonderful information. And I know there's so much more you wanted to share, but unfortunately with the time and all of the difficulties we had in between, I think this will be sufficient. Maybe on a different stage, we can have another discussion and then we can dive into different things.
Okay, it was my pleasure. I love talking herbs, so
I'm sure
thank you for inviting me.
You're welcome. Have a lovely evening, everybody. Have a good night.
Bye-bye.
Okay, bye.